To increase the probability of a successful transplant, the human leukocyte antigen tissue typing, or HLA, of a donor must match as closely as possible with that of the recipient. These genes encode for proteins on the surface of the cells in the body, including white blood cells. Also known as antigens, they regulate the immune system and enable the body to differentiate foreign cells from those of the patients themselves. About 30% of patients have a family member who is a close enough match to donate. The remaining 70% have to search the worldwide registry of unrelated donors. Since tissue type is inherited, a patient's best chance of finding a genetic match lies with those of a similar ethnic or racial background. In some cases, doctors may recommend what is known as a haploidentical transplant, which means that rather than being a perfect match, the donor is a half match. The donor used is a relative. Parents are always at least a half match for their children, and siblings have a 50% chance of being a half match for each other, not to mention a 25% chance of being a perfect match. Another option for patients for whom a sufficiently matched related or unrelated donor cannot be found is an umbilical cord blood transplant, which we'll learn about later on in this video. Since the search process can take some time, it's important to act quickly. This includes a prompt visit to a transplant center, HLA tissue typing the patient and blood relatives right away, and beginning an unrelated donor search. To save time, these can be done concurrently. Thanks to a central database called Bone Marrow Donors Worldwide, or BMDW, transplant centers can search the tissue types of millions of donors from dozens of registries in countries around the world. With any luck, a donor will be identified rapidly, and the transplant can proceed without delay. If there are no matching donors, some patients and their families choose to run recruitment drives in the hope of finding a match.